Recording in progress.
Hello everyone, I hope you can hear me well. And this evening we are going to have a brief talk on stroke. Sorry for the inconvenience with the technical errors. So we'll not delay the talk because we intend to finish it in a stipulated amount of time. Without further delay, today's topic, I would like to repeat it once, and that is all you need to know about stroke in 20 minutes. So this topic I was, when I have thought about it, I started it with a thought about the general public awareness mostly, and also later on then I also thought that it will be definitely beneficial to those doctors who are going to refer patients with like the first primary care physicians and the first contact physicians who would be referring patients to the for further management. So, brief introduction. I'm Dr. Bilal. I practice. I'm a DM neurologist. I practice general neurology here in Hyderabad. With that out of the way, stroke. So, with the topic and with the audience in mind, what I have thought about is I'll be concentrating mostly on the number one is prevention. Okay. So number one is prevention. Number two is what are the early diagnosis, how to recognize stroke if somebody is having a stroke. Number three is what are the treatment options and what are the decisions, because when you go to the hospital, most of the what we observe is most of the patient attenders are a little clueless, obviously. What is the thing and what are the options available, what will be the expenses, and all these questions are there, what we can do at this point of time. So that I'll try to educate you on or let you know about that. And then the other thing is once somebody has had a stroke, what to expect, how to manage, I mean like the long-term management plan and stuff. So the first thing which I would elaborate on is the preventive aspect. So first thing is prevention is better than cure. I think we all have heard that many times. So how to prevent stroke is to prevent the risk factors. Risk factors is a term used to denote all those factors that can lead to a particular disease. So stroke risk factors are there are many risk factors to be if we have to talk about, but then the important risk factors which are most relevant and preventable, there are non-preventable risk factors like the age of a person or the genetics of a person. These are like constant features that are already inherited. So nowadays we can change the genetics if we recognize early, and stuff like that is happening, but it's really in the research stages. So coming to the preventable risk factors, the important risk factors for stroke. Uh, so primarily stroke is ischemic, that is clot in the brain, or hemorrhagic, that is bleeding inside the brain. A blood vessel can burst, and that leads to interruption in blood supply. Like if a pipe of the municipal pipe bursts, then we have an interruption in our water supply. So similar thing, or if the pipe blocks, we don't get it. So these two things can happen in the interruption of blood supply to the brain. So that is basically stroke. So in those, when I was talking about, I came to this because in both the types of stroke, particularly in the hemorrhagic type of stroke, the important risk factor is hypertension, that is blood pressure, BP. So whoever is having BP, whoever is having hypertension, these are same things. So those people are at high risk of stroke, because what this blood pressure is doing is it's continuously pushing against the walls of the blood vessels. Blood vessels are like pipes. They are supplying blood to the different parts of the brain. So when the blood vessels are getting, when the blood is getting supplied to the brain, these pipes are getting distended and normalized, sequentially. So what happens is, if there is a very high pressure against the blood vessels, it tends to either burst or it becomes hard. And once it becomes hard, then also there are erosions that can form. And then what happens is, once there is a cholesterol is normally present in everyone's blood. So when cholesterol deposits on these blood vessels, and then this BP, what it does is, it causes different problems with the cholesterol and the bursting of the blood vessels. We'll not go into, I have decided that we'll not go into much into the pathophysiology, how it is happening and stuff like that. We'll concentrate on the general, what are the things that matter to us in terms of treatment and decision making. Because ultimately these things we need to know how the stroke is happening and how to prevent it. But then what you need to know is what are the risk factors and what to do about it. So the number one risk factor is hypertension. Number two is diabetes. Number three is obesity, or high amount of fat in the body. Number four is alcohol. Number five is smoking. And then there are quite some other risk factors. One important risk factor is, if somebody has already had a stroke, what they do is they take medicines for a few days and then they stop those medicines. So what happens is, whenever you have a stroke, there are some particularly ischemic stroke, that is in a clot in the brain. You have to take some medicines which are lifelong. And if you don't take these medicines, if the patient doesn't take these medicines, they get another stroke, which is usually very more severe, and which is usually it doesn't recover. So number one is BP. What to do about it? You have to early recognition. So BP also you have to recognize early. Periodical checkups are one way. Now the other thing is, we have to if somebody is having a headache or any neck pain sometimes and dizziness sometimes, then they should get their blood pressure also checked, apart from the routine other checkup. Then so that is taking care of BP. So you have, if somebody is having blood pressure, they should take their medicines regularly. Some people have a wrong notion. They think that whenever BP rises only they'll have to take. When suppose they are having headache, then BP is 180, 180 by 100, then only they'll have to take. Like that they'll think. But the reality is, when there is a hypertension, when the person is getting diagnosed with hypertension, it is expected to be high every day or most of the times. So you have to take medicine every day, daily. It's not like every now and then you're taking. So problem with that is, suddenly BP may rise and then bleeding inside the brain happens, and something like clot may also happen. So these number one is hypertension and regularly taking hypertension medicines. This is number one prevention uh, step which you should take. Number two is diabetes. Diabetes is very common, particularly in Hyderabad. It is known as a diabetes capital of India, and we have every other patient has hypertension, diabetes, or both. So almost. So that diabetes, the thing is, apart from the medicines which we take, the important thing about diabetes is, diabetes actually, it is a metabolic disease, which is a component of syndrome called as metabolic syndrome. So what happens is, suppose we are eating more of sugar and more of white rice, that goes and gets converted into fat. And this fat, as it goes on accumulating in the body, this fat it causes insulin, something called as insulin resistance. So insulin keeps rising in the body, but still sugar, it is not able to push the sugar inside the cells. So it is like there is plenty of food outside, but cells are not able to take it inside, because insulin is not able to work, because there is a lot of fat in the body. So these people continue, keep on eating sugar, keep on eating white rice, and continuously they keep on increasing their diabetes. And their medicines also, diabetes medicines also, accordingly they'll have to keep it increasing. At one point they'll start insulin, so already insulin is high in the body, and they'll start insulin again on top of that, and then insulin is more high, and then more fat accumulation. So this cycle keeps on continuing. So how to, the important thing I'm trying to highlight here is, not only diabetes medicines should be taken properly, but also the root cause of diabetes should be taken care of. So you should not take white rice, you should not take sugar. These two are very important and root causes of diabetes in most of the people, and they should be absolutely avoided. You can take brown rice, you can take some, so you should avoid sugar mostly in your diet. Glucose is better because fructose component in sugar is directly converted to fat. So this is the second advice, taking care of the sugar. Then obesity. Obesity, of course, most of the obese people have knee pain. So they'll say, "अरे घुटनों में दर्द है तो चलना कैसे डॉक्टर साहब?" So the solution to that is that we have to initially try to reduce the weight with the help of diet. And once diet is suppose somebody was to 120 kgs, and from there they have come down to 90 kgs with the help of diet, then they are, or maybe depending on height, maybe they have come down to 70 kgs or whatever, and then they can actually start walking. They can then do exercise. So that way, diet and exercise, these are important components of sugar control. And lifestyle also, what you're eating, how you're eating, when you're eating is also important. Which it is better to eat whenever you're hungry, and not keep eating whenever whenever food is available, or even in between and everywhere. So the thing is, fasting is absolutely found to be beneficial. Intermittent fasting has found to be a very good tool in combating diabetes. So I have told about hypertension, I have told about diabetes and obesity. And obesity, this only, all these things: intermittent fasting, diet and exercise. And then coming to the smoking, of course, smoking is bad for health in terms of causing cancer, lung cancer. It can also cause vessel disease and atherosclerotic. We call it as atherosclerotic disease. So that should be avoided. And then taking care of the alcohol consumption. Alcohol should be avoided. It should be stopped. And so these are the risk factors and important risk factors of stroke. And other thing which I told is very important. That is also very important. If somebody is having an ischemic stroke anytime in their life, even in a hemorrhagic stroke, after 3 months, they need to take antiplatelet, ecosprin, it is a aspirin, clopidogrel, and these type of drugs are available. And they should be either of these in proper doses should be taken, and they should be taken lifelong once an ischemic stroke happens. And if you don't take those medicines, you can have a larger stroke and you may not recover at all. Some people recover and then they stop. That is a very big mistake. So these things are there. This is a very important point I would like to emphasize, that if you have had a stroke, consult your neurologist and take the medicines lifelong. Some medicines are there that you have to take lifelong. Then coming to, so those are the risk factors, and those you should avoid and try to that is the important thing. Next is early recognition. Early recognition, somebody, if suppose, how will you take the patient early to the hospital? All the doctors, in stroke, one important thing is time is brain. So you should get the patient as early as possible, within 15 minutes, within 1 hour, within 2 hours if possible. Then we can treat it completely, and patient can walk out on a stretcher and walk in, can be brought in on a stretcher and walk out on his own legs. This type of a situation may happen if you bring the patient within 2 or within 4.5 hours. Particularly earlier the better. So how to do that is recognize the stroke early. Number one is many strokes happen in sleep. So of course that is difficult to recognize. But if it is happening during daytime, immediately come to the hospital. So how to recognize stroke is be fast in stroke. BEFAST, be fast. So B stands for, if there is any balance abnormality, if the person is falling down while walking, or not able to touch his nose, for example, or hold the glass properly, if he is not able to assess the position of the glass while he is holding, these type of things. Balance problem, number one. Number two, eye problems. If there is any loss of vision, if one thing is appearing as two things, then there can be a problem, stroke in the brain. And number three is F, fast. B ho gaya, then it is FAST, fast. F is face. If there is a facial drooping, or if there is any other, sometimes there is a speech, speech will come to that later. If there is a facial drooping, then that may also indicate a stroke. Then A is arms. So there can be a weakness in the arms, or there can be a difficulty in movements of, difficulty in finer movements, like touching touching a particular point. Usually why I am saying nose is because we use the nose as in clinical testing, we use it to touch the particular point. So if somebody is feeling weakness in the arm, or if they are having difficulty in their grip or anything, particularly weakness or imbalance, these things in the arm, that can be a stroke. FAS, S is speech. If there is any complete cessation of speech can happen sometimes, particularly right side when the stroke happens, there is a complete cessation, complete stop of speech. They cannot speak at all. But sometimes there is dysarthria. Dysarthria means there is a slurring of speech. That is the problem. तो बात बराबर नहीं आ रही, जबान मोटी हो गई बोल के बोलते. So that is another symptom. And then T. So be fast. Balance, eye problems, face problems, arm weakness, speech problems. Then immediately be fast. Immediately there is time for action. So be fast in stroke. If there is any of these symptoms, time for action. Time for action is immediately call the ambulance, preferably a stroke, where a neurologist is available, a stroke protocol is available, a stroke center should be called, preferably nearest, not very far also, because immediately we have to start the injection. Now coming to the treatment options that are available, and what decisions you might have to make when you are going to take your loved one or whoever your relative is there. If you are going to take them to the hospital, what decisions you might have to take there. Number one is, this is important. Now I'll tell you what are the options available. Number one is, if you get the patient within 4.5 hours. Suppose at morning 10 a.m. the patient was having facial drooping and right side weakness of arms and legs, and also he was not able to speak. So immediately, suppose you have taken them to the hospital within 4.5 hours, then within that time window, if you get the patient, we have to do a CT scan immediately. And then if the CT scan is not showing any bleeding in the brain, then we have to do a thrombolysis. Ischemic stroke is the commonest type of stroke. So we have to do a thrombolysis. Thrombolysis is basically in heart also, in cardiac problems, when there is a heart attack also, they give a strong medicine to dissolve the clot. Thrombolysis is same thing. We give a strong medicine. Usually we use alteplase, or there is another option called tenecteplase. We use these options to dissolve the clot. So these two things. So if you get within 4.5 hours, we can use a medicine. We can dissolve the clot. Patient can immediately start moving his arms. Immediately facial droop may get corrected, and then immediately he may start speaking also. So these things are very much possible, and they have happened in these are the so 4.5 hours. 4.5 hours we can give thrombolysis. Up to 6 hours if you get the patient, then we can do. Then of course, like there are sometimes we can also give the medicine depending on how the stroke is evolving. So in this now, once the intra-arterial thrombolysis was used up to 6 hours, but so basically I'll give you the timeline. Number one is 4.5 hours. We can give the intravenous directly from the vein. We can give normal, like we give the vein medicine, we can give that, and that type of procedure can be done within 4.5 hours. If you come later, like 6 hours, 8 hours, then like angiogram type of procedure has to be done. Like in heart also they do angiogram, angioplasty. That type of procedure has to be done, and that is up to 8 hours. Up to 8 hours also there is a chance. Nowadays, these timelines are being a little bit advanced in selected patients. So if the patient is fitting into certain criteria, even intravenous medicine can be given up to a duration of say 8 hours or 12 hours. Particularly if there is a wake up stroke, in a stroke where the time of onset is not known. In that type of stroke, we see the images, we see the MRI images, and decide that okay, this patient will what happens is the center initially, if this is the brain, and here the blood supply, if this part blood supply is completely lost, only the center part first will die, and then remaining part, like that. This remaining part is called penumbra. So initially only the core will be infected, remaining part will be good. So based on the MRI, we can try to save that remaining part. So number one is thrombolysis. Even after 4.5 hours, there is a chance of giving drug medicine inside your veins to completely dissolve the clot. Even up to 24 hours, there is a chance of doing an angioplasty like procedure that is called a stroke intervention. Okay, so even up to 24 hours, there is a clot retrieval. We call it as a clot retrieval. We can do a clot retrieval with an angioplasty type of procedure. We can completely cure the patient. Even up to 24 hours also we can do it. So these in selected patients. So this is the importance of getting the patient early. If you get the patient within 4.5 hours, we can probably treat him within 1 lakh rupees. If you get the patient or maybe 1.5 lakh, depending on where you're going, and then if you get the patient later on, then it may take 5 lakh rupees. If you get the patient after 24 hours, then there is no chance, like there is no treatment available. So even if you pay any amount, that patient may be paralyzed for the rest of his life. This is the importance of, you know, the early treatment of stroke, early bringing the patient to us early, recognizing and bringing. So suppose if somebody has had a stroke and they are out of the window period, out of this, you know, where we cannot give strong medicines, then we give them some other, you know, medicines which can, blood thinner medicines, which can prevent further strokes. And slowly what happens is the other areas of the brain start functioning, and then they take up the functions, they form connections with the damaged neurons, and you know, they take up the functions of the damaged brain. So uh, if somebody has already had a stroke, the options available are, of course, blood thinner medicine should be taken lifelong, very important point. And then physiotherapy is an option. Physiotherapy means exercise, and other things are there. They stimulate the nerves with the electrical current and stuff like that. So these things are important. Speech therapy is available, swallow therapy is available. You know, even vision, you know, even that type of therapy is available. Not very commonly though. So these things are available as long-term options. So finally what I would like to tell you is, you need to get the patient, recognize the patient early with the help of be fast, that is balance eye problems. If somebody is having balance problem, मतलब सोलगिनट्टुन्नदी, झूल रहे हैं, मतलब like somebody who is drunk, so PS आदमी के जैसा कर रहा है बोलते बोलते. So that way, if somebody is having balance problems, eye problems, face, you know, deviation or drooping, and then arm weakness, leg weakness, or imbalance, and then speech problems, and then you have to take them to the hospital early. So today's message, bottom line is, you recognize the stroke with these points which I told you. If somebody of your relatives, particularly hypertension, diabetes, those who are having BP, sugar, these type of patients are very prone to get a stroke. So that type of patients, if any of your you know, mother, father, grandmother, grandfather, whoever is having, even young people can get a stroke. So whoever is having this BP, sugar problem, they should be watching out for these symptoms, you know, balance, eye problems, face problems, arm weakness, and speech problems, and then they should immediately get them to the hospital if these things happen. Okay. And sometimes in hemorrhagic stroke, of course, hemorrhagic strokes are a little different. They can, apart from these things, they can also have headache, and they can also have vomiting sometimes. So those are the things that are there. But anyway, you should recognize any stroke early and bring them to the hospital as early as possible, preferably to a hospital where a neurologist is available, and where thrombolysis is available, where stroke intervention preferably is available, if it is nearby your home. If so, that is the thing. And so that is the message I would like to. So, and also risk factors I have told you. So lifestyle, very important, sugar and white rice. Okay. So, and exercise and diet. So all these things are there. These are the bottom lines, bottom take home messages that I would like to leave you with. So that's, I think my time is already up with a good margin already. So yes, almost, I think I have been sticking to the timeline almost. So it's been 23 minutes. So I would like to end it with a message that stroke is not really a curse if you recognize it early and get the treatment early. Even later on we can treat, but not as good as if you get the patient early. So please try to recognize the stroke symptoms in your loved ones early and bring them to the hospital. And you know the options that are available. Whenever, if somebody of your loved ones are having these symptoms and you reach the hospital within 4.5 hours, tell them to you know, contact a neurologist, do a CT scan, and start the thrombolysis. It's not an extremely risky procedure. Thrombolysis decision making, how you have to do is, see, thrombolysis, one thing is cost. So if you are giving alteplase, the cost of the injection itself may be around 75,000-80,000. Apart from that, the other decision which you have to make is, Suppose if you are giving thrombolysis treatment to suppose 100 patients, okay? Among that 100 patients, 35 people may become 100% okay, and then some amount of people may not benefit from that, and only 5% of the people, matlab 100 में से 5 people, 10 में से half, so 100 में से 5 people, 100 में से 5 people can actually get bleeding inside the brain. So that is the risk. So if somebody, and depending on, we see some factors, suppose if stroke is very large and hemorrhagic transformation is there, better to avoid thrombolysis. So we also can see and avoid certain situations where bleeding inside the brain can happen due to this strong clot buster medication. But sometimes they can also bleed, and 100 from 100 individuals, some very small percentage of individuals can actually die with those bleeding due to this strong clot buster medication. So so this decision you have to make, but whatever it is a very beneficial treatment. And I think rather than if any person is given a choice, would you like to get paralyzed throughout your life, or a very small risk of bleeding inside the brain? And it's very small risk, and we don't usually see that happening. So better than being paralyzed for life, I think it is better to try to cure yourself and go for the thrombolysis. I think it's a very good treatment, and absolutely beneficial, more beneficial than conservative management. Conservative management is just that there is no much injections, only much tablets we use to manage the condition. So clot buster medication we won't do. Okay, thrombolysis, that is called conservative. So better is thrombolysis, but there is some chances of bleeding. But see, even with accidents, so many people die. So there also there is, you are going and driving the vehicles, and it's a very high percentage. I'm not having the exact numbers, but so with every, I think 60,000 kilometers or 6,000 kilometers, one fatal accident can happen. So these type of things, even then we go on the road and we drive. So sometimes we have to take a risk when the benefit is more than the risk. So that type of situation is there in thrombolysis. Don't, I think we should not think too much in that situation. So thrombolysis is a very good option available. In hemorrhagic stroke, one point I would like to emphasize for the public is, whenever hemorrhagic stroke happens, there is a edema, matlab there is a sujan aati dimag mein after the blood gets accumulated inside the brain. So that when that situation is happening, there is an increased pressure inside the brain, and some part of the skull might have to be removed to decrease the pressure. This treatment, don't delay the decision. If your doctor says that it is absolutely required, take a second opinion if you want to take, but take it within half an hour, and don't delay this procedure of relieving the pressure inside the brain. It is very important decision, and you should not absolutely delay it as far as possible. So with that, I would like to end this session. And if you want to contact me, my website is mybestneurologist.com. MYBEST neurologist, NEUGO NURO GOLIST, neurologist.com. So if you want, that is my website, mybestneurologist.com. You can contact me through that. And with that, I would like to end the meeting. Good night. I'm not able to see any questions. I don't know if there are any questions. Okay, I think there are no questions then. Are there any questions from the audience? I think it's being relayed in a different place. Okay, so I would like to end it.
Recording stopped.